So do I ice my back if I have back pain? Really common question. Tons of people ask about it all the time. And it's a controversial topic, icing in general. Some doctors don't even know when you should ice and when you shouldn't ice. So don't feel strange that you don't know what the answer to that question is. But you'll learn the steps of icing properly and a couple of those controversial ideas at the end of this video. So what does icing actually do? Icing acts as something that reduces pain. It actually directly affects those pain fibers. So you don't perceive the injury. You don't get that feedback from your brain that you're in pain, which allows you to become more active. You can engage sometimes in exercise more. You can do certain things that you probably would not be able to do or be concerned about doing because you're getting that pain response. Second part is inflammation. Inflammation is what occurs when you initially have an injury, especially in the early stages. It's reacting, cells are coming to the area, there's a lot of heat, it's a big chemical reaction, and it's the effort of the body to heal the area, clearing out the dead tissue, get ready for those new cells to come in to lay down new tissue. And during that period of time, some of the belief is that you actually have secondary injury right around the injury site, and by reducing the inflammation in the body, the inflammatory response, we start feeling better, and you have less pain because there's less inflammation, and it speeds the recovery. It's one of that, and that is probably the most prevailing thought about icing. So for most injuries, similar to back pain, whether you had a fall or trauma or just kind of gradually came on, all part of an injury, we ice. We ice for close to 48 to 72 hours. That's probably the most important period if you really are going to embrace icing as a way of recovery after back pain. And a lot of orthopedic injuries, that's the thought, is to ice the first 48 to 72 hours. And at that point, it becomes a little debatable whether you want to do ice or heat. My big contention is, I understand it helps you, is we have to realize that is one part of a whole of things that you want to do on a road to recovery. And we don't want to rely on it. It's part of an overall treatment. So as we talked about earlier, icing for back pain, I do feel like there's some benefits to it. My general recommendation is that it's all right to ice. If you really feel strongly about it, you feel it helps you after trying it, ice. But also it's part of an overall treatment plan. So someone comes to me, wants just general recommendations. What I tell them to do is the following. I don't want you to sit more than 20 minutes. In extreme cases, sit, stand, or lie down actually. I don't want you in one position too long, okay? So I want people getting up every 20 minutes. We put it on their smartphone. You need a reminder. In really severe cases, I'll tell people every 10 minutes to get up. There's a guy named Dr. Stuart McGill. He works with high-level professional athletes. He's telling them to get up every 10 minutes in times where the back pain is really severe. I think there's probably something to it, okay? Doesn't matter, athlete, non-athlete, get up, move around, don't stay steady. I also like to have people do a simple walking program. Get out, get a little bit of movement there. Not the shutdown, especially after the first 2 or 3 days where you may have had to do some bed rest and lie down more than you can just because you just can't move, okay? Ice as needed, but actually slowly as you feel like you can move forward, to move as much as you can as long as you don't have a setback. And that can be simple as walking for 100 yards, walking for 50 yards, and going back and sitting down. But we got to get you moving a little bit and not completely shut down. Essential to feeling better with back pain. Okay? And oftentimes, if you're evaluated by a therapist, I'll give you a very specific exercise to do throughout the day, somewhat related to your posture and being aware of that. And but that's only after an evaluation by a therapist. So those are some of the main points. So let's go into the different aspects of how to ice, how long, and things we should be aware of. So when you first apply ice, you're going to go through a few stages. First, you're going to feel cold. Shocking. Then you're going to feel like a burning, tingling sensation in the area. All very normal. Then you almost get an achiness feeling. And eventually, the last stage, you're going to feel numbness. And that's when you've gone through the necessary stages. Very common, just want people to understand what to experience and what is normal. If it actually becomes painful, especially in the areas where you're talking about spasm, or it's just too cold for you, you may not be able to do this. So, but those are some of the experiences you should get as you apply the ice. Remember, 10 to 20 minutes, and then take 40 minutes off. So it's kind of on the hour in a way. That'd probably be the most I want, because I also want you, what did I say? moving a little bit through that time. Move as much as you can through the day that doesn't cause your condition to worsen. The major thing we talked about earlier was just doing a little bit of gentle walking, okay? And then if you've got an evaluation, typically you'll get exercises that are appropriate for you, okay, which we'll go over in another video. So these are one of the ice packs that we use in the clinic here. It's a little pliable, it kind of gives a little bit to my finger pressure, and it contours to your back and your anatomy. Everyone's anatomy is a little bit different. Some people that have a lot of extra body weight, they will it won't be as essential to have this kind of pack. But if someone that's got really bony prominences, doesn't have a lot of muscle bulk around them, they may actually find some of these more rigid cold packs are really uncomfortable, okay? So once you apply it, you can put it in your fridge. This is using a simple pillowcase in between your skin, so you don't develop any kind of burn or anything like that. In fact, one of the things with icing, you have to be careful if you have any kind of neuropathy or loss of sensation in certain areas. It might be after surgery, related to diabetes or some kind of condition, other type of vascular problems, if you have an open wound. So there's several issues about when it is appropriate to ice. Some people really can't do it because they can't feel if they're overdoing the ice too, if it's too cold. But we like to wrap it in a little pillowcase here and put this between the skin and the surface. Sometimes just having a shirt on is enough of a barrier in between, but I like to kind of make sure we have a little bit more in between the surface of your skin and the ice pack. If you're talking about a lower back condition, which we're generally talking about here, I like to have people lie on the ice pack with their knees slightly bent. So this is the ice pack. Legs like so. I like to have the knees slightly bent. They find that you can do this, or you can put a wedge underneath your legs. They find this position has the least amount of lower back pain pressure or disc, and especially when they looked at the study, was the disc pressure was the least amount in that position. You got to make sure it's comfortable. You know, sometimes you just can't tolerate that position even with icing. You can do it in sitting if you have to, but we don't want to sit too long. Sitting is typically a more provocative position than lying down. It's something that kind of you feel worse from doing it. And it's not even the ice. It's the fact that you were sitting for 10 to 20 minutes and it's too sensitive to that long a period icing the area. So I hope this helped you make a better decision about icing and back pain and kind of gave you, some good information to make the decision that's best for you. Everyone's back is unique, so every situation is unique. When you're unsure, you've got to see a therapist or doctor to get more information for your particular back condition, okay? Whatever you do, don't stay still. Try and do some proactive things. A little education by a physician or if they're a physical therapist can go a long way to decrease that apprehension and concern. But icing can be a good start for a lot of people, not for everybody. Okay, listen, if you like this video, smash the like button. If you're not subscribed to our channel, please subscribe or share this with someone that has a back problem and has some questions and concerns. It can be very alarming, disconcerting, and we want you guys to feel better and start moving as fast as you can back to feeling better and doing the things that you enjoy doing. Have a great day.